afternoon, everyone. This is Candy Ferguson coming to you live about eating disorders and mental health. First up, we're going to be talking about anorexia nervosa. This is when someone severely restricts food because they are terrified of gaining weight. And even if they are dangerously underweight, they may still look in the mirror and think that they are overweight. Patients may skip meals, obsess over calories, over-exercise, even misuse laxatives and diuretics. And physically, the body starts waving red flags everywhere. Low blood pressure, dizziness, dehydration, loss of menstruation, and osteoporosis. The body basically says, I cannot keep surviving like this. Next, we're going to talk about bulimia nervosa. This disorder usually involves binge eating followed by purging, like self-induced vomiting to avoid weight gain. And here's what makes bulimia tricky. Many people with bulimia are actually average weight, so the disorder can go unnoticed, but internally, serious damage is happening. Frequent vomiting can cause dental erosion, electrolyte imbalances, muscle cramps, and even muscle complications. So while social media may glamorize unhealthy body standards, the body itself is literally deteriorating. And finally, binge eating disorders. This involves eating very large amounts of food in a short period of time, usually tied to stress, emotion, or coping. Unlike bulimia, these patients typically do not purge afterwards. And over time, this can lead to obesity, hypertension, diabetes, heart disease, and emotional distress. So what causes all of this? Well, unfortunately, there is no single cause. But risk factors include depression, anxiety, trauma, bullying, low self-esteem, family history, and honestly, social media pressure. Basically, imagine carrying emotional pain every single day while living in a society obsessed with filters, unrealistic body standards, and comparison culture. Now, from a nursing perspective, our role is huge. We're not just checking vitals and documenting weights. We're also monitoring hydration, electrolytes, mental status, eating behaviors, and emotional well-being. And sometimes the best intervention is simply creating a safe place where a patient can finally feel heard instead of judged. Treatment usually includes therapy, support groups, nutrition counseling, and sometimes medications like fluoxetine and olanzapine. But recovery is just not about the food. It's about rebuilding self-worth, and that takes support, education, patience, and trust. So to conclude today's report, eating disorders are not diets, they are not attention-seeking, and they are definitely not just about food. They are serious mental illness that can become life-threatening without treatment. And as future nurses, we may be one of the first people to recognize the signs and help someone start recovery. Back over to you, Miss Melissa. Thank you for tuning in to tonight's special report. I'll now return you to the regularly scheduled program.